Hello, I'm Dr. Maria Sulindro. I'm practicing integrative anti-aging in Pasadena, California. Thank you for listening. And today with me, I have my guest speaker, a very dear friend of mine, very famous actually in this field. Okay, his name is Dr. Stephen Sinatra. And let me introduce him and his background. Dr. Stephen Sinatra is an board certified integrative cardiologist. He was an assistant clinical professor of medicine at the University of Connecticut School of Medicine in Framingham, Connecticut. He is certified in bioenergy psychotherapist and nutrition and anti-aging specialist. So now you know already his scope is very big, okay? He is a founder of heartmdinstitute.com, just in case you want to check that website, an informational website dedicated to promoting public awareness of integrative medicine. His career included 9 years of chief of cardiology, 19 years of director of medical education, and 7 years as director of echocardiography. Today, Dr. Sinatra is active primarily as an author, speaker, and advisor for the research and development of targeted nutritional supplements. He joined the Healthy Directions family in 1995, and his nutritional supplements are offered on drsinatra.com. He's actually one of the first clinical cardiologists to endorse coenzyme Q10. I'm sure many of you knows about coenzyme Q10, and you can check on this website that he's actively promoting healthy products. It's called vervana.com, VERVANA.com, a healthy, organic, non-GMO, metal-free, preservative-free products. Now, I will repeat this again, but let me greet my guest speaker today. Hi, Dr. Sinatra.
Oh, Maria, thanks so much for that really nice introduction.
Okay. Well, your biography is very long, but pretty soon they will learn who you are if they have not heard of you. But I always talk about you among, in front of my audience when we have lecture in the house, or when we talk about cardiology. Your book is everywhere in my office. These are what I have here that they are very familiar. I used to buy a few of them, and then I will just loan them all these these books, and they love it. And it's actually, I was looking for the Earthing. I couldn't find it. That's my favorite because
it's all over the place. I mean,
I know.
Text me your address, and I'll be happy to send you a copy.
Oh yes. Thank you so much. Now I would like to. The topic today is how heart health facts. So I'd like to start with the first questions. What are some of the heart health facts that are the most important to address today?
Well, I mean, if you look at the spirit of the times right now with these killer viruses that are going across the world, and COVID-19 is certainly one of them. As a heart specialist, the problem is that COVID-19 can lock into the heart cells because of the ACE2 receptor. In other words, it locks into the lung, and a lot of these people, if they don't have good levels of vitamin D in their body, or coenzyme Q10, or omega-3s, or quercetin, I mean, we can talk about targeted nutritional supplements that can help combat COVID-19. But right now, I think COVID-19 is the elephant in the living room. And as a heart specialist, we see a lot of cardiovascular complications. And the secret to not getting COVID or any of the variants is to strengthen your immune system up and really use targeted nutritional supplements as a way of fortifying your immune system. And if we don't really get into that in depth, I would say that I think one of the most important ones to take is vitamin D. In other words, if you have a really good vitamin D blood level, and I'm talking about a blood level that is, you can measure it about 60 to 70 UGs per ml. The problem is the average vitamin D level for many people, even living south of Atlanta, like you're in the Las Vegas area, is that? No, you're in Los Angeles
Los
area.
Angeles area.
Yeah. Oh, San Francisco.
No, Los Angeles.
Oh, Los Angeles. Yeah.
Yes,
Yeah. Even a lot of people in Southern California, they have low vitamin D levels. And the reason being is that, a lot of people, they'll walk outside, they'll go to the beach, but they put sunblock on. And people don't realize that whenever you put sunblock on or sunscreens, you block the absorption of UV light that is required to take the UV light from sunlight. It interacts, with the vitamin D in your skin, or the cholesterol in your skin, and that forms the vitamin D3, with the cholesterol in the skin and the UV light. So, I see a lot of people, I live in Florida half the year, and I see a lot of people bathing themselves in sunblock and everything else. And, it's a half hour of sunlight won't hurt you. And it's really vital. Sunlight is really a good healer. And one of my future books is God's Simple Cures, where, sunlight can be very, very healthy for people. And a half hour a day is really good. I mean, a half hour of sunlight, you can get 20 to 50,000 units of vitamin D just by exposing your arms and your legs and maybe a little facial features for a half hour, 15 minutes to a half hour, and it won't hurt you.
I agree with you. And, of course, there are details in how to have a sun bath for 15 minutes at what hour of the day and things like that. But I agree with you. Some of my patients who are server or lifeguard, they have only vitamin D of 20 or 15. I was so surprised initially, but I'm not surprised now because they use sunblocks, and also maybe the methylation is not done correctly in their body.
Right.
So 60, 70, 80. If my patient has cancer, I even
go to 100. Yeah,
bringing up to 100. I think toxic level is 300 now. But many people with heart disease, Dr. Sinatra, they always think about this blood pressure. Are there natural way also to lower blood sugar? Blood sugar, not blood pressure. So they are concerned because the link of the metabolic system and also cardiology problems are there. So is there any other natural ways to lower blood sugar instead of just dieting?
Sure. Great question. And I'm glad you brought up the subject of blood sugar, because again, the elephant in the living room is COVID-19. And we know that the major comorbidity of getting complications from COVID-19 is a higher blood sugar. And why is that? Well, diabetics, or whether you're type 1 or type 2, if you have high swings of high blood sugars in your body, or if you're eating a lot of sugary foods, like even a normal person who eats a lot of sugar, a lot of colas, a lot of candy, a lot of donuts, a lot of carbohydrates, if their blood sugar is soaring, what happens is basically higher blood sugars can stifle the activity of white blood cells. And, in an epidemic or a pandemic, you need your killer cells. You need your killer cell activity. So blood sugars can higher blood sugars can be an impediment to getting well. And that's why I think a lot of type 2 diabetics and even obese people, for example, who have a lot of obesity and insulin resistance, these individuals, can be in double handcuffs. Now, blood pressure is a problem too. Blood pressure is another major comorbidity. So, if you look at some of the three top comorbidities for COVID-19, and what I mean by a comorbidity is, in other words, this is something that you are more prone to get complications if you catch the virus. And the higher your blood pressure is another factor. And it's really good to keep blood pressure at bay. And there's lots of ways of lowering it. Weight loss is the easiest thing to do. I can tell you, as a heart specialist, I would have my patients lose a mere 5 or 10 pounds. And, a lot of these patients would, go down at least 10 points on their blood pressure. So, weight loss is good. There's lots of targeted nutritional supplements. I like cinnamon. I like berberine. I really like berberine. You probably remember this, Maria, but at the A4M years ago, a lot of the docs were taking metformin because metformin was a way to actually regulate blood sugar. Now these same docs have switched to berberine because, berberine actually supports the development of or drives the metabolic pathway of AMPK. And whenever you do that, you are sort of toning down the machinery of regulating these metabolic reactions in your body. So I love berberine. I like cinnamon. And again, the lower blood sugar, the better. So more healthy fats, more higher proteins, less carbohydrates in a diet. And I think that's really important during this pandemic.
Thank you. Thank you for that info. I'm your patient today, okay? So I'm going to ask you, you're my doctor. So what are questions we should be asking our doctors about heart health?
Well, I mean, one of the most important things that I used to ask my patients when they came in, especially if they were coming in with chest discomfort or shortness of breath, or, patients would come in and say, I don't feel right, doc. I climb a set of stairs. I get a little pressure in my chest. I get a little ache in my jaw. I would hear, housewives tell me that they were doing dishes or, washing curtains or washing windows using arm motion, which would drive blood pressure up and increase cardiac output. And they were getting a little bit of discomfort. And basically, I would always ask these patients, well, this could be cardiac related. We need to investigate it. We can do simple tests like an echocardiogram or an exercise stress test and, get some blood work. But the one question that I would always ask people is, tell me about your family history. Because one thing I've always found out, Maria, was that if I had a sudden death in the family, let's say somebody in their 30s or 40s, and I had many situations like that, because that's all I practiced was cardiology for decades. If I had a family history of early sudden death, that used to bother me because I would turn these people inside out. In other words, I would look at their blood, I would look at their risk factors, I would get lots of different blood studies just to make sure they didn't have toxic blood syndrome. I would check everything from homocysteine to Lp(a), naturally their cholesterols, but their insulin levels. I used to do so many things just to make sure that their family history wasn't a harbinger going forward and that they had a defect. And I'll tell you this, and I've had family histories with young heart attacks or young sudden death. And the one risk factor that I saw, and I'd say almost half of these people, was a high Lp(a). Not a high cholesterol, but a high Lp(a). Now, a high Lp(a) is like a very, very small cholesterol particle. It's very inflammatory, and it makes the blood act like red ketchup. In other words, the two worst things you can do in the cardiovascular system is have inflammation and have red ketchup blood. And that's what Lp(a) did. And a lot of people had this anomaly, but they didn't know it unless I checked their blood for Lp(a). The problem is, even today, a lot of cardiologists don't check it because there's no drugs that treat it. In other words, you have to treat Lp(a) with non-pharmaceutical means. And when it comes to Lp(a), the lower the Lp(a), the better. But when it's out of range, when it's high, you must neutralize it, because that is the one risk factor that I used to get very, very concerned with my patients, because that risk factor you can take to the bank is a very, very dangerous risk factor.
Yes, thank you. Yes, I agree with you, and hopefully we can talk about how to. But what are some of the signs there may be a heart or heart related issues? Maybe we should tell the listener about this one, like some of the signs.
Sure. I mean, first of all, if you're a male and you come to my office and you came in and say, Dr. Sinatra, I'm getting pressure in my chest when I walk my dog. I mean, to me, that's almost pathognomonic that he's having angina or a heart cramp. And some of these men would say, Doc, I get this substernal heaviness in my chest. Sometimes it radiates to my arm. It goes in my back. I don't feel right. That to me needs investigation. Now, in a woman, all bets are off. The diagnosis of coronary artery disease in a woman is very, very difficult. A lot of these women have atypical symptoms. They can have just shortness of breath. They can have jaw pain. I mean, I remember I saw a woman in the emergency room. She was waiting to see an oral surgeon for like 2 hours. And she didn't look right. She was pale and ashen, but she had only jaw pain. And the head nurse asked us, called in an oral surgeon. He was in the OR. And she came over to me. I was seeing somebody else. She says, would you mind taking a look at this woman? She doesn't look right to me. She doesn't have chest pain. She's not short of breath, but she just has jaw pain. Maria, she was having a massive heart attack when I took the EKG.
Very unusual, yes.
A massive. I'm not talking about a small heart attack. I mean, she had the whole anterior septal wall involved. And if I didn't see her quickly and treat her aggressively, we would have lost her. But the thing is that when it comes to women, and I wrote about this in my book, Heart Sense for Women 20 years ago, when it comes to women, some women get substernal chest pain and some women, get radiation into the neck. But sometimes dreadful fatigue can be a factor. I remember I saw one woman, she had a dinner party and she all of a sudden at the end of her dinner party and she was washing her dishes. It was like almost midnight. She still had a lot of guests there. All of a sudden she told me, Dr. Sinatra, it was very difficult for me to walk across the room. I felt like I had no strength in my legs. I felt like I was going to pass out. I was totally weak. I just sat down. I got a little bit better. She waited till the last dinner guest went home.
Wow.
She went to the emergency room at 2:00 in the morning. And again, she was having a massive heart attack. And her only symptom was dreadful fatigue. So when women get these atypical symptoms, they're not like men. That's why I think in the future, we're going to see gender-specific medicine. In other words, I think women cardiologists are going to only be treating women because women and men are very different. Their anatomies are different. They respond to angioplasty differently. They respond to bypass surgery. I mean, look at some of these drugs we treat women with. We give women non-steroidals, like the NSAIDs, the Motrins, the ibuprofens. And a lot of these women get hypertension, but not men, but women do. It affects the kidney. I mean, there's so many different ways women react to drugs than men do. Like, look at statins, for example. Women get horrific side effects from statins, whether it's liver or peripheral nerve or weakness or whatever. Men get side effects too, but women get a lot more side effects than men. So, when it comes to drugs, when it comes to treatments, when it comes to presentation of symptoms, women and men are very, very different. Very, very different.
Mm-hmm. Yeah. Well, that's interesting. Yeah, maybe women cardiology.
Yeah, I mean, and by the way, there is information in the literature where women who treat women with heart attacks, these women who see women doctors who are having heart attacks, they literally do better when they're seen by a woman as opposed to a male cardiologist. Think about it.
I see. Wow.
I think women, now you know I'm a psychotherapist as well, but I think women connect with other women better. There's a lot of silent, non-verbal communication that goes on. And
How
I
about
think
men connect with men, or it's okay for men to see a women doctor? Do they connect?
Yeah, it's okay, but I really feel that women who are women cardiologists, I have a feeling that because heart disease is so much more prevalent in women today than it was years ago.
Oh,
I mean, if you have to, be like a man and work like be like a man. No. Be like a woman, work like a man, and work like a dog, something like that. It's an unholy trinity, but a lot of women are in, the corporate environment. Let me give you one example. I saw this when I was a young cardiologist. I saw a woman, she was 28 years old, and she was the only woman who worked with 8 different male vice presidents of a major bank in Hartford. And now think of this. She developed uterine cancer at age 28.
Stress.
Uterine cancer. So she had a uterus taken out. She had a history. She was castrated, right?
Yeah.
Now I'm a psychotherapist. Energetically, she became more like a man physically, because she was working with, 7 or 8 other men, and it was rough for her. So she had to become more like a man to work in that horrific environment. I'm talking 30, 40 years ago. But basically, when it comes to women, they're softer. They're, if a woman shuts off her tears, for example, I think crying is the healthiest thing you can do for your heart, having your emotions, having your tears out. But when these women are working in these, high profile jobs as CEOs and managers, et cetera, if they can't have their feelings, and if they stuff their feelings, or worse yet, if they don't act on their intuition, because a woman's intuition is very strong, but a women, they betray their intuition because they're in the workplace and they feel that this right brain stuff is not the truth, but it is the truth. And there's so many aspects. But when a woman becomes a little more like a man, what happens? She develops a man-oriented disease, and that's heart disease. So that's why I'm bringing psychotherapy to the table in this discussion.
Oh, that's very interesting. So while I'm a woman, and there are many women listening, and what can we do right now to increase our heart health, Dr. Sinatra?
Well, I sort of condensed it to my 6 pillars of healing.
Yeah, good.
I mean, one of the books I'm writing now, actually, I'm writing a book on Get Grounded, Get Well, but the book after that is High Vibrational Living. And all my 6 pillars of health, they increase the vibratory state of your cells. And whenever your cells are vibrating, they're sort of like dancing with one another, and they don't become stagnant. It's just like when people get stagnation in the bowels, they get constipation, and people who get more constipation or stagnation in the bowels, they get more GI cancer. There's no doubt about it. I use that as an example. But basically, when it comes to heart health, we want to keep our cells vibrating. Look, even prehistoric man, right? Prehistoric man knew that all life depended on a pulsating heart. So we got to keep our cells pulsating. So how do you do that? I mean, how do you keep these vibratory cells pulsating all the time? Well, I like the Mediterranean diet. I mean, the Mediterranean diet is just incredible. I mean, look, there's more 100-year-old people in the Mediterranean basin than in the entire world. I mean, whether you live in Libya or Turkey or Italy or Spain, it doesn't matter. It's that Mediterranean basin. Now, this is interesting because the Okinawans, they had the best longevity in the world. But Spain and Portugal have just surpassed them, and Italy are the top 3. And the reason being is that, I think it's the Mediterranean diet. Now, look, the average American only lives 8 years lower. Think about that. 8 years lower than the average Mediterranean. So the average Mediterranean lives longer. But what's so special about the Mediterranean diet? Well, lots of fresh fruits and vegetables, lots of garlic and onions, lots of artichokes. It's good for the liver. Lots of seafood, omega-3s, which are non-inflammatory, from the Mediterranean basin. They don't eat a lot of meat. They eat, like Americans eat chunks of meat, big chunks of meat. But the Mediterraneans, they tend to flavor their sauces with meat, whether it's lamb or beef or whatever, but they don't eat the chunks of meat like we do. And the common denominator, I feel, of the Mediterranean diet is olive oil. I mean, there's no doubt in my mind. Olive oil is the kingpin. It is the kingpin of the Mediterranean diet. I read this article in a genetics. Actually, the journal was called Genomics, and this article was about olive oil and what olive oil does to the body. Now, look, Olive oil does everything from having a positive effect on cholesterol and blood sugar and triglycerides and non-inflammatory mediators. We all know that, we know that as doctors. And the pre-med studies showed that there was less heart disease, less cancer, less Alzheimer's disease, in people in the Mediterranean basin. And that was published in all the major journals, including the New England Journal of Medicine. But there's one thing special about olive oil. And I don't know if your listeners know this, but what olive oil does, especially if you're taking 4 tablespoons a day, that's what I do every day. I use it on salads. I use it on fish. I use it if I cook meat. I use it all the time. And even at Vervana, I've toured the olive oil. I mean, the olive groves, these organic olive groves in California. I mean, because I'll tell you one thing, California olive oil is amazing because it's not cut with canola oil. Because if you get a certification by the California Growers Council, I can show you that. Hold on a second.
Okay.
Hold on. I'm going to show you.
Good. We're going to see his products now.
Yeah, no, this is one of our olive oils. This is a Korenicki. It's all organic, but I don't know if you can see this. This is a seal of approval by the California Growers Council to certify that it's 100%.
What is the brand there?
Oh, this is called Korenicki. This is Vervana. In other words, if people went to my website, vervana.com, we have these, on our website. But the reason why I wanted to,
is that unfiltered? Unfiltered?
Oh yeah. These are cold pressed, extra virgin.
Yes.
I mean, these are the top of the line. I mean, doesn't get better than this.
Okay.
And like I said, they're not cut with canola oil. Now look, 10 years ago, when this study came out in genomics, when all the olive oils in Western Europe, they were pure olive oil. Only in the last 5 years, 60 Minutes did a whole program on this, where a lot of the olive oils coming out of Europe now are cut with canola oil. And you know that canola oil is good for machines, but it's not good for the human body.
Yeah.
And basically, canola oil is very pro-inflammatory, but it's a lot less expensive than olive oil. And the problem is, a lot of the manufacturers in Western Europe, if they put 25% of canola oil or less in their bottles of olive oil, the label can say 100% extra virgin. That's horrible because, it's not telling the consumer the truth. But anyway, back to this study in genomics 10 years ago, what extra virgin olive oil does, it takes pro-inflammatory genes that we're all born with. We've learned that from the Biogenome Project that was discovered more than 20 years ago, where, 3 researchers got the Nobel Prize where they mapped out our genetics. But what olive oil does, it takes these pro-inflammatory genes, we all have them, we're born with them, and guess what? It reverses them back to a non-inflammatory state. That's why, I think, it's my belief, that there's more 100-year-old people in the Mediterranean basin because they're taking in olive oil daily, and it was good olive oil, and basically that's why they have the best longevity in the world. So when it comes to the Mediterranean diet, I'm all in on olive oil.
Thank you.
So that's one pillar.
Information, yes. But
second pillar is walking. Do daily walking. Walk the dog. Do some walking. I try to walk every day, or some form of exercise. Whatever it is. It's just important. It's you want to keep your weight down and do some exercise. Okay. I'm a big believer in targeted nutritional supports. That's my third pillar. Mm-hmm. I believe in metabolic cardiology. I like coenzyme Q10, carnitine. I like D-ribosan, magnesium. That's my energy type of awesome foursome. Anybody with heart failure requires that. I'll tell you that. We can talk about that later. I like a mind-body program. I used to teach at Cervananda in the Bahamas, and that's a great yoga institute. I used to go there for years. And yoga is incredible because whenever you do a twist, when you breathe into the twist, and a twist is a little bit uncomfortable, or a pose, for example, whenever you do that and you breathe into it, basically you're turning on the parasympathetic nervous system, and you're lowering the sympathetic drive, so to speak, and you release hormones. that have a calming effect on the body. So mind-body medicine, yoga is part of it. Prayer, meditation, it all works. I love it. I absolutely love it. Qigong, Tai Chi. I mean, I studied Tai Chi, and being Oriental, I mean, you know all about Tai Chi, and where you're taking your energy and you're just forming the energy and you're moving the energy.
Yes.
Very, very important. One thing that a lot of people don't realize that's extraordinarily important is detoxifying the body.
Yes.
I mean, everybody needs to do some form of detoxification every day. I mean, every day. I mean, whether it's your bowels, whether you're taking a lot of fiber or psyllium or, probiotics is extremely important. Detoxification is important. Sweating, when it's warm weather, when I go out for my walks, I'll wear a couple of sweatshirts. Why? Because I know how valuable sweating is. What a lot of people don't realize, Maria, a lot of us have insecticides and pesticides in our body, as well as heavy metals.
Yes.
And these environmental contaminants, they're in this sort of the subcutaneous layer of the skin. So if I poke my skin up here and it tense, it's that little fatty area, throughout my skin area of my body where these toxins lie. That's why if you go into an infrared sauna, right? If you go into a sauna and you sweat, these toxins come out of the subcutaneous areas of the skin in form of sweat. And then you take a shower and you flush down all the mercury, all the cadmium, all the lead, all the insecticides, the pesticides, all that stuff that's in the subcutaneous layer of the skin. So, I really like detoxification. And my last pillar, I'll tell you, it's free, it's easy. You walk barefoot in Mother Earth. You ground to the Mother Earth energy. We call that the Schumann effect. It's almost like the Om that the yogis do. When I was at Servananda, we would have our sessions where, we would do our meditation and Om. Well, the Om that the yogis do has a resonance of 7.83 hertz. That's the same resonance of the Mother Earth energy. In other words, when you walk barefoot on grass or in sand or on a beach or in concrete or brick, not asphalt, asphalt's man-made. You won't conduct the Mother Earth energy. But when you walk barefoot, you take in this resonance, the Schumann resonance, which comes from lightning strikes, when lightning strikes the earth and sun flares and all that stuff. You take in this energy. And you know what the Schumann resonance does? It acts like CoQ10 in the body. It's amazing. It's incredible. CoQ10 is an electron donor, and so is grounding. They're both powerful electron donors. So when you take in the Schumann resonance, basically you're detoxifying the body, which is absolutely amazing. And you're giving the body back electrons. And whenever you give the body back electrons, whether you're taking handfuls of antioxidants or using grounding, you're tying up free radicals. Whenever you do this, the body becomes healthier. So it's free, folks. Just go out in your backyard and put your bare foot on the grass or concrete.
Yes, walk on the grass. Yes.
Oh, and what I do, when I walk with shoes, see these shoes?
Oh,
these are grounded shoes.
Yes.
That's a grounded graphite. That's on the bottom of these leather shoes.
Oh.
And, we have them on our website, grounded.com, and there's harmony.com. There's so many websites that offer, I sleep grounded, for example. I sleep with a grounded sheet. I walk grounded. I mean, I did all the research on grounded. I mean, I believe this with all my heart.
I use your grounding bed cover.
Oh, good. That's good.
Thank you for that. Yes. But okay, you talk about good diet, but what would you say, Dr. Sinatra, is the one worst dietary habit that people do on a daily basis that is virulent risk factor regarding heart disease or heart health?
Great question. And, a lot of people fear cholesterol. We need cholesterol. Cholesterol lubricates our skin. It gives us vitamin D. It gives us sex hormones. We need cholesterol to integrate impulses in our neurons in the brain. People fear cholesterol. They're on the wrong track, Maria. They got to fear sugar. Sugar is the enemy. Sugar drives insulin. And whenever you drive insulin, insulin is an endothelial cell unfriendly hormone. It causes inflammation in blood vessels. And look, all these kids, for example, they go to these fast food restaurants. They're drinking 16-ounce colas, 32-ounce colas, and they're getting loaded with, 30, 40 teaspoons of sugar in a cola. I mean, it's awful. And, look, if people want a little, dark chocolate for dessert, let's say a few squares that has a polyphenol activity or a dark chocolate concentration of greater than 70%, I have no problem with that. I mean, dark chocolate can lower your blood pressure. These are really, dark chocolate has the polyphenols, similar to olive oil in a way. And it's these polyphenols that are anti-inflammatory. So, if people need a sweet, I would say go with dark chocolate. But the problem is, as people are just putting sugar and loads of sugar in their coffee, the average American eats about 160 pounds of sugar a year. We're eating far too many carbohydrates, too many bagels, too many breads, too many pastries, too many sweets, too many semolina pastas, which are pure sugar. That's why we use high protein pastas at Vervana. We use a chickpea pasta and a red lentil pasta, which are high protein, so you don't get that insulin response. But people got to realize that sugar, that's the enemy. That's the one enemy of the heart is sugar, not cholesterol.
The more we tell people that sugar is bad, they think that they never taste sugar and they try to taste it again.
That's right. You're absolutely right.
Yes, but what foods are especially helpful in protecting the body from ravaging of aging? We are in the anti-aging world now, so.
Yeah. Well, there was a great study I read about aging and sugar about 20 years ago. It came out of Australia, Western Europe, and North America. And basically, what it showed was that the more sugar you took in a diet, the quicker you aged in your skin. And it makes sense because sugar, when sugar combines with what we call we call it age glycation, basically. Sugar in the body, when it combines with these proteins in the body, the more sugar, we get more what we call age products in the body. And these age products break down and it accelerates aging. And that's why the more sugar these Australians or North Americans or South Americans were eating, they age their skin more. And basically accelerates aging. So, sugar, again, people got to realize it's the sine qua non of ill health. It really is. I mentioned extra virgin olive oil. Again, I'll mention it because, again, it's one of these substances that turns back those pro-inflammatory genes. And if it wasn't for the Biogenome Project, that we mapped our genes, which is only, like I said, 27 years old. We never would have been privy to this information. So the doctors of the future, I'm in my 70s and I'm probably about 15 years older than you and stuff like that. But, the doctors of the future, I can tell you this, Maria, they're going to do a buccal smear on you or a blood analysis. They're going to find out where your SNPs are, where your bad genes are, these new doctors are going to figure out through genetic testing, you have a COMT problem. You have an AMPK problem. It's going to be like alphabet soup. You have a homocysteine problem. In other words, they're going to figure this out so quick. They're going to say, you need this drug, this supplement. You got to avoid this food. It's so simple. What did we do in our careers? Differential diagnosis. Somebody comes in with a problem. We say, it could be this, this, and this. Now somebody's going to come in. They're just going to figure out your genetic map and say, hey, you are very inflamed. You need to do this, this, and this.
I hope they find it before they have the disease.
Oh yeah, that's the doctors of the future. They're going to be involved with preventive medicine. You don't want to get sick. Nobody wants to get sick in America. Come on. I mean, we got to prevent this stuff. I mean, who needs to be sick? It's just awful, So anyway, I would just tell most people to be their own doctors, and just follow simple. It's like God's simple cures. It's so simple, a little sunlight, a little grounding, less sugar, higher protein, targeted nutritional supplements, a little prayer, forgiveness, a little optimism, all these good things, keep people healthy.
Okay. So you mentioned several times about this COVID-19 era now. Our good friend, Dr. Cynthia, is also there asking questions. So this is my question also. So the COVID-19 epidemic has a dreadful cause of draining energy from our bodies, and people cannot sleep. They are fatigued, depressed, and many experience panic attack as well. Is there anything we can do to boost energy levels while improving the immune system at the same time? And, for Dr. Cynthia, she found many of her COVID patient has a myocarditis or epicarditis. So can you comment on this one, please?
Yeah. The COVID virus, it locks into the ACE2 receptor, which is found in the lung. They're found in the GI tract. They're found in the kidney. They're also found in the heart. So these pro-inflammatory, it's like a lock and a key. They connect with one another. They cause enormous inflammation and endothelial cell dysfunction and tissue breakdown and bleeding. That's why a lot of people bleed into the lung. And I would suspect that the 5G technologies also contribute to this because, people who are getting a lot of electromagnetic frequencies from 5G, if you look at some of the centers, the epicenters of the world, like Wuhan, China, Milan, Italy, Switzerland, Madrid, Spain, Seattle, Washington, the New York City area. These were 5G areas where the virus, the same frequency of the virus and the 5G, are similar. So, doctors like you and I that study frequencies, and we're energetic like doctors. We study energy. So that's like putting yourself in double handcuffs. So it's important to realize that whenever it comes to COVID-19, you need to protect yourself from these unseen energies, these electromagnetic energies. So for people who have survived COVID-19, I would tell them to use wired computers, get the Wi-Fi out of your house. Like, for example, I'm talking to you right now on a wired computer. I am wired into the wall. This is not Wi-Fi. I have no Wi-Fi in my house. When I talk on a let's say a cell phone, I always use speaker. I never put it towards my ear. The worst thing you can do is put a cell phone towards your ear. I was lecturing at the A4M 15 years ago, and everybody thought I was a quack. And now they think I was a savior because now it's all coming out that these cell phones are very, very toxic. Yes. So it's just important. In other words, we got to tell our people, our patients, to be productive without being self-destructive. I mean, that's really the key. So, we need to get the Wi-Fi out of the house. We need to ground more. We need to be privy that these electromagnetic waves can be disastrous. Now, look, how do you protect yourself from this severe blood clotting, endothelial cell dysfunction, where blood vessels rupture? Well, I'll tell you, CoQ10, and somebody's going to do this research, but CoQ10 prevents endothelial cell dysfunction. And it also is a potent NF-kappa B inhibitor. You see, one of the reasons why people bleed into the lung or the brain or the heart, for that matter, because of the virus locking into these receptors, is you get enormous endothelial cell dysfunction. And then we have what we call a cytokine storm. We produce NF-kappa B, interleukin 6, C-reactive protein. These are inflammatory chemicals, and these are inflammatory mediators. And when these inflammatory mediators get so high in the body, it causes a storm that goes out of control. That's why we call it a cytokine storm. And what we need to do is neutralize these inflammatory mediators. And again, vitamin D can help with this. Quercetin can help with this. Certainly, coenzyme Q10 can help with this. I mean, there's lots of things you can do, simple interventions you can do to make yourself healthy. I mentioned less sugar, less carbohydrates. So, the beauty in this epidemic is that there's things people can do, whether it's diet, getting some sunlight, getting the vitamin D, taking CoQ10, getting away from the electromagnetics, getting away from the Wi-Fi, from the computers, grounding more, having your feelings out more. Stop living in fear, having your feelings out. discharging your emotions. If you need to cry, cry. It's very important. Crying is one of the best things to alleviate the heartbreak we all have, but it won't lead to heart disease, and what's in tears? Endorphins, So in other words, there's so many things we can do as human beings that if we, God forbid, if we catch the virus, we can do things, but we can also prevent it. And that's where I stand on energy. And again, the people who have survived COVID, who have dreadful fatigue, I like my awesome foursome. I like D-ribose, a teaspoon, maybe twice a day, and a little bit of water, a little bit of juice. Take some CoQ10 with it, a couple of 100 milligrams, maybe a little bit of L-carnitine, and certainly some magnesium. Magnesium is a must because magnesium also supports the endothelial cell lining.
Right.
And again, this is what we really need going forward with this pandemic.
Yeah. Okay. I know I promised you 30 minutes and we are 3 hours difference. I have a few questions now. Let me just combine these questions.
Okay.
You have seen many tragic events, such as sudden death, which can greatly affect couples who have been together for 30 years, 40, 50 years. And in addition to everything you have said, what else can be instrumental in combating the loneliness that occurs with the loss of the loved one? And when you explain that, please remember, in your lecture, you always stated after heart attack, like a pet that offers unconditional love can be life-saving.
Oh,
and
absolutely.
Explain about that. Yeah, these 2 questions about your psychotherapy things. Okay.
Yeah. Now I'm going to talk more like a psychotherapist as opposed to a cardiologist. But here is the data on cardiology first. If you have a heart attack and you come home to an empty house, a lonely house, or if you have a hostile spouse, so to speak, where they're arguing and all the time, your incidence of sudden death is 400% higher, as opposed to somebody coming home to a pleasant house, or even a pet. And, this intrigued me because I've been a pet lover for years. I mean, I've had dogs in my life ever since I was a little boy. And when I had my elk hound and 2 chows, I had 3 dogs. I was going to get a 4th dog, but then I needed to get a kennel license in Connecticut. So I only had 3. But these dogs, they lived, 2 of them lived to 15 and a half, and 1 of them lived to 16 and a half. And I had them spaced out. So I had dogs for decades. And basically what I found was I was feeding these chows a lot of sardines and my elk hound as well. They contained a lot of omega-3. They contained CoQ10. Then I started to give them CoQ10, and then they outlived their counterparts by 2 to 3 years.
Wow.
And that was amazing. But why is it so important for our pets? Because pets bring so much to the table. And, I am convinced, Maria, that pets will always love you. They will, even unfortunately, some of them get abused, but they will always give you unconditional love. They will always love you, whether it's a cat or a dog. Cats sometimes they'll jump on a person's chest while they're resting and they'll be purring on your chest. And there's nothing more beautiful than that. A dog, a pet. Just petting a dog lowers blood pressure. There's been scientific studies. It lessens arrhythmia. So when a dog looks at you with these loving eyes, and if you can take in that just feeling of love, it heals the heart. It absolutely is healing the heart. That's why I developed Ageless Paws. That's why we give CoQ10 drops to dogs. We give these treats that are fortified with CoQ10. They're like salmon or bison or organic poultry, or we use turkey heart fortified with CoQ10. So in other words, I love to nurture pets because pets give so much back in terms of cardiovascular prevention.
Yeah. Wow. Okay. Yes. I wish everyone really have a pet, as a emotional support, because I do believe in that. But as a board certified cardiologist, you, Dr. Sinatra, and you mentioned many doctors, not many mentioned about spirituality, and the heart like you have had in some mentioned in your books. Aren't medicine and spirituality on opposite sides of the spectrum, or is it the same?
Well, unfortunately, they're not. See, a lot of, I mean, look what's going on with COVID-19. Everybody's saying, what's the science? What's the science? What's the science? You know what I mean? That's the same thing in medicine. You know that. Everybody wants to have the science, you know, and you and I both know that 35% of the published literature in medical journals is fraudulent, you know? I mean, we know that information. But you see, spirituality is grounded in faith. And we all need faith, and we all need to be just be more optimistic and just to be more in touch that, you know, there is a higher power. And that's why I believe so much in prayer and meditation. And, you know, in my books, you know, one of the most important books I wrote on spirituality was with Tommy Rosa. I actually met a man who was run over by a truck who went to heaven and back. And you got to realize, Maria, I've been at the bedside of many dying people. I'm an invasive cardiologist. I do cardiac angiograms. I put in emergency pacemakers. I see people in the OR, in the delivery room. I mean, I see the worst of the worst. I mean, that's what I did for decades. And I saw at least 19 to 20 life after death experiences, you know, people floating on the ceiling, watching me resuscitate them, people going through a tunnel. I mean, I've had it all. And I got to tell you, I was prepped. I was really prepped for Tommy, because Tommy's life after death experience lasted forever. I mean, he got inculcated into his brain by spiritual masters in heaven, information. And when I talked to Tommy, he used to be a plumber, but he came back as a health provider. I mean, the guy knows more than most doctors because he got inculcated into his brain by spirit, you know? So, you know, even in my books, I'll never forget one woman, she was only in her late 30s, early 40s. And she had a thrombosis of the superior mesenteric artery, and she infarcted, or she had black bowel. You know what I mean? In other words, her small intestines was just wiped out. So when she had an acute abdomen, a surgeon was called, and he opened her up, and she was black inside. He closed her up, and he said to the family, he said, "There's nothing I can do. She's going to die in the next 24 hours." I mean, she was like a Civil War victim that got shot in the gut, so to speak, with you know, one of these Civil War bullets that were this big, and people, you know, the soldiers always died because we didn't have the medicine like we do today. But basically, what the surgeon didn't know, and what I didn't know, was that the woman's family was connected to hundreds of churches in Connecticut, New York, New Jersey. They're a very religious family. So I just told the family, I said, just pray. That's all you can do is pray.
Yeah.
Maria, this is amazing. There were hundreds of thousands of people praying for this woman. She had young kids and everything else. She walked out of the hospital under her own power 3 days, 4 days later. She completely healed. Now, was that a miracle? Was that spiritual healing? I mean,
I do believe in that.
Yeah, it's just absolutely amazing. So, you know, I wrote about it in one of my books, and hey, listen, I always told my patients when they were on their deathbed, there's always hope in a prayer.
Yeah.
And actually, I learned that from Bernie Siegel. He used to say that at his lectures all the time. He was a Yale a surgeon that you know, believed in spiritual healing.
Okay, this will be one of the longer video. I'm going to close with one more question, but let me clean all these questions from the listener. Okay, I think one of them would like to know, how does the earthing works for the heart? Okay, and then well, you already mentioned about DOP on the coenzyme 10. How do you give it to the children?
First of all, children do not need CoQ10 because they're young. They don't need it unless if they have asthma or a chronic inflammatory condition. If they're over the age of 8, 9, or 10, if they can swallow capsules, or a lot of them are liquid gels. You can squeeze it out in their food and put it in applesauce and something like that. But generally, children don't need CoQ10 unless they're chronically ill. So even young adults in their 20s or 30s don't need CoQ10. It's only after the age of about 35 to 40, well, we need CoQ10 because of the toxic environment. And if you have any cardiovascular illness, you certainly need to take, higher doses. Dogs need CoQ10 because, see, a lot of dogs eat older animals in cans where the older the animal, or like the older the human, the less our cells make it. So, a lot of dogs will eat dry food, for example. They won't eat animal food. They'll eat plant foods, which contain very little CoQ10. So basically, a lot of dogs die of heart failure, cardiomyopathy, but it doesn't go on the cause of death. It goes down as old age, but they really had, heart failure.
Yeah,
So,
multiplied by 7 is their age. Now, what about this earthing connects to?
The earthing. Earthing does two phenomenal things. It thins the blood. It makes the blood like red wine. And in our research, it thinned the blood 283%. And you got to realize in this day and age, we want our blood to be like red wine. When it becomes more like red ketchup, then it clots. If it clots in the brain, we have a stroke. If it clots in the heart, we have a heart attack. If it clots in the superior mesenteric artery, like that young woman had, we call that an infarction of the bowel. So basically, we don't want the blood to stick. The other thing that grounding does, it balances out the sympathetic nervous system. Maria, everybody's living in fear today. Everybody's living in vigilance. You know what vigilance means? It's waiting for the other shoe to drop. Whenever you live in fear or uncertainty or panic or vigilance, your autonomic nervous system, the sympathetic component, goes sky high. You're putting out cortisol. You're putting out adrenaline. You're lowering your serum potassium. You're making your blood more like red ketchup. Whenever you do these metabolic changes to the body, it causes, havoc in the body. But whenever you ground and you take in the Schumann resonance or the Om, whenever you do that, now you're taking down the sympathetic nervous system and raising the parasympathetic nervous system. You're balancing them. And all of a sudden you have harmony in the body.
Harmony. Okay. All right. I'm going to close soon, but as a heart specialist, I'm sure you have seen people with enormous dread, despair, and also pessimism. What do you tell these people?
Well, if a person has despair or cancer or heart disease, I ask them to visualize their cup as being half full as opposed to half empty. In other words, a lot of people see themselves as victims where, oh, Dr. Sinatra, my cup is, half full, blah, 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 blah. Optimism is important. I'll never forget, I was a young cardiologist in my 30s when I read this study about, actually my 30s and 40s, because the subsequent study came out about these nuns, Catholic nuns, who wrote love letters to themselves when they were in their late teens, early 20s, mid 20s. And then they reread them, decades later. And the nuns who were the most optimistic had the least disease. Think about that. Optimism heals the body. Pessimism kills the body. So whenever, like with the COVID-19 pandemic, if we have to stop living in fear. We have to just realize that there's many ways of protecting ourselves living in this epidemic. There's so many ways we can protect ourselves. And we discussed it on your program. But again, we have to be optimistic. We can't be pessimistic. We can't be waiting for this other shoe to drop. We have to live our lives, but protect ourselves at the same time. And I said it before, we got to be productive without being self-destructive. If we do that, we're going to be in good shape.
Yes. Wow. I really always enjoy listening to how you explained. And that's probably because you really know on both sides, spiritual causes and also the medical field causes. So thank you so much for today, although we actually reached almost an hour. Can you believe that now in your time is your bedtime now? Thank you so much, Dr. Sinatra.
Bye-bye, Maria. God bless.
God bless.
Bye.
Thank you, everyone, for listening. Don't forget, thumbs up for Dr. Sinatra. And his website is Vervana, VERVANA.com. And you can see his endorsement on all these healthy products. And I'm Dr. Maria Cilindro, integrative anti-aging medicine, practicing in Pasadena, California. I'll see you next time, Dr. Sinatra.
Bye-bye, Maria. Thank you. Bye-bye.
So much.